Hello friends, welcome to part 17 of solved Pharmacy MCQs videos series, and in this video we are going to discuss another set of MCQs which will be 10 in number, and also we will try to discuss them in some detail, how much may be possible. So big welcome to this video. And so our first MCQ of this video is all of the following antipsychotic medications are rarely associated with neuroleptic malignant syndrome (NMS), except one that is more commonly associated with this syndrome. So which is that one? Actually, we are asked to identify the drug among the below given options that is more commonly associated with neuroleptic malignant syndrome. Well, the rest of drugs are not so much related with this condition. So options are given: clozapine, olanzapine, risperidone, quetiapine, haloperidol. Actually, the options clozapine, olanzapine, risperidone and quetiapine are actually second generation or atypical antipsychotics, while the E option, that is haloperidol, is a first generation antipsychotic. And actually first generation antipsychotics are more commonly associated with neuroleptic malignant syndrome. So haloperidol is the right answer here. E. Now coming to the second MCQ, the enzyme renin is secreted by. Options are given: adrenal gland, kidneys, liver, spleen, pancreas. So actually the enzyme renin is secreted by kidneys. So B is the correct option here. Now the third MCQ, one of the following diuretics is an osmotic diuretic. So options are there: indapamide, bumetanide, amiloride, acetazolamide and mannitol. So drugs from diuretics class are given, and the MCQ asks us to identify the osmotic diuretic among the following. So among these, the osmotic diuretic is mannitol, while the others are not belonging to this class of diuretic. Acetazolamide is a carbonic anhydrase inhibitor. Amiloride is a potassium sparing diuretic. Bumetanide is a perhaps thiazide diuretic. No, sorry, it's a loop diuretic. And indapamide is a sulfonamide diuretic. So among these, mannitol is the osmotic diuretic. Now the fourth MCQ, among diuretics, which class has the strongest of diuretic action? So options are there: thiazide diuretics, loop diuretics, potassium sparing diuretics, carbonic anhydrase inhibitors, osmotic diuretics. So this MCQ asks us to identify the class of diuretics that has the strongest of diuretic action, that is, they are most potent and most effective. So actually in these options the correct answer here is loop diuretic. They are actually high ceiling diuretics. This is their second name. For their effectiveness and potency is much more compared to these other classes of diuretics. So B is the correct option here. Now the fifth MCQ, ethacrinic acid acts exactly at which site in the nephronal structure in order for it to exert its diuretic action. Actually, we know that ethacrinic acid is a loop diuretic, and loop diuretics actually act on the loop of Henle. So the other options are irrelevant here. So among these two options, one is the correct. So either it is thin descending loop of Henle or thick ascending loop of Henle. So actually ethacrinic acid, that is a loop diuretic, it acts at the thick ascending loop of Henle, and it is at this point that it will exert its pharmacological action, that is diuresis. So C is the correct option here. Now the sixth one, thiazide diuretics acts exactly at which site in the nephronal structure in order for them to exert their diuretic action. So we are asked to identify the exact site in the nephronal structure where thiazide diuretics will act and exert their pharmacological action, that is diuresis. So options are given: proximal convoluted tubule, thin descending loop of Henle, thick ascending loop of Henle, distal convoluted tubule, and collecting tubule. Actually thiazide diuretics, they exert their action at the distal convoluted tubule. So D is the correct option here. Now the seventh MCQ, Noyes-Whitney equation in pharmacology is useful in the prediction of rate of drug absorption, rate of drug metabolism, rate of drug dissolution, rate of drug elimination, and rate of drug distribution. So actually Noyes-Whitney equation is useful in the prediction of rate of drug dissolution. Now the eighth MCQ, carbonic anhydrase inhibitors like acetazolamide acts exactly at which site in the nephronal structure in order for them to exert their diuretic action. So again options are there: proximal convoluted tubule, these are actually parts of the nephron. So the nephronal structure consists of these parts: proximal convoluted tubule, thin descending loop of Henle, thick ascending loop of Henle, distal convoluted tubule, and collecting tubule. Actually carbonic anhydrase inhibitors like acetazolamide, they act at the proximal convoluted tubule site of the nephronal structure and exert their pharmacological action of diuresis. So A is the correct option here. Now the ninth MCQ of this video, a healthcare provider orders for kidney function tests of a certain patient. For creatinine clearance, he will be consulting the normal range, which lies somewhere between. Again 5 options are given, and it is asked to identify the normal range, that is normal reference range of creatinine clearance. So these options are there. Actually the normal creatinine clearance range, reference range, is 80 to 120 ml per minute, meaning per minute this much creatinine should be cleared from our body. So this is the normal creatinine clearance. Now the last MCQ of this video, Pernicious anemia occurs generally due to the deficiency of which agent? Folic acid, vitamin B12, both A and B. D option is iron. E option is riboflavin. Actually, pernicious anemia occurs due to the deficiency of vitamin B12. So actually this agent deficiency leads to the condition called pernicious anemia. So friends, I think this is enough for now. Thanks for watching, and please, if you have any difficulty in understanding any of these MCQs, then please ask me in the comment section below, and I will take my time to answer your question and maybe solve your difficulty. So thanks for watching, friends.